Good evening. I'm Dr. Frank McGeorge, and this is the medical producer here at WDIV, Sarah Mayberry. We're both here after a press conference that Governor Whitmer held this evening to announce 2 new coronavirus cases that were just diagnosed within the state of Michigan by state-level testing. So we want to talk a little bit about the import of that. And I think I want to begin simply by saying this really does not change anything from what we had expected. And by that I mean we have seen the map, if you will, of the United States filling in all around us. Illinois, Indiana, Ohio, all of the states around us have been gathering cases. So it was no surprise that ultimately there would be cases in the state of Michigan. So these cases are really confirmation of what we've basically suspected all along, and that there would be cases here eventually.
Now, that said, now that it is confirmed, I think that this is a time when people who may not have been paying attention may start paying attention. People who were afraid of this may start being more afraid. Obviously, there is never a good time to panic, but what do you want people to do now? I mean, what does this mean from a practical standpoint for people in this community? Because the cases are in Wayne County and in Oakland County, one related to international travel, one related to domestic travel, but we don't know how long these people have been here. We don't know where they have been in the community, how many people they've interacted with.
And that's part of it. We don't have a lot of the details to fill in the blanks that might make you feel better about what your circumstance is. And I think in general, right now, we still need to think very broadly that there is the probability that these are not the only 2 cases. These are the only 2 cases that we have identified. Now, that said, these 2 cases, one being international travel, one being domestic, that is travel within the United States, depending on how long they were within our community, Oakland and Wayne County, depending on who they have come in contact with, what their level of activity was in the community, it's quite conceivable that with contact tracing, as the state is going to be doing, epidemiologists will be looking at everybody that they may have been in contact with. It's quite conceivable that they may have come in contact with other people who may be contacted, and they may be asked to isolate themselves. This is not a time, as Sarah said, to panic, but it is a time for everybody to sit up and say, no, really, this is here. I mean, for anybody that doubted it for a moment, like, oh, Michigan is safe somehow, this is proof that this is here, and this is going to grow. And Dr. Caldoun, who's the chief medical executive for the state of Michigan, during the press conference in the Emergency Operations Center, made it very clear. These are the first 2 of what they expect to be many cases within the state as they roll out further testing. Keep in mind, so far the state of Michigan had this morning 63 patients under investigation. That is tests that they had done. 39 were negative previously today. 24 were pending today. Of those 24 that were pending today, 2 of them were positive. So basically, they still have more cases that will be rolling in over the next couple of days from hospital referrals, from community referrals, and we expect many of those will be positive. And frankly, even if they're not positive, I would still make the assumption, based on the fact that we know now that there are 2 cases in Michigan that may very well have exposed other people in the state, that there is a likely probability that it is here, and it is in at least Wayne and Oakland County, 2 of our more populous counties, obviously, but you shouldn't think that you're safe anywhere in the state. This virus clearly spreads very rapidly. If you look at the way it's spread across the country, the number of cases has escalated as we test more. And I expect that the state of Michigan is going to accelerate their testing, especially now that we know where we should focus, especially because there have already been identified cases.
And I understand from our website, everyone is asking, okay, where in Oakland County, where in Wayne County? They did not announce that tonight. We do not expect them to announce that. However, what is going to start happening is they are going to start talking to people who may have been in contact with them, and I think that's when we'll start to hear more details. So it's not going to be like with measles, where we got a list of every place they were and every time that they were there, because it's not that sort of virus. But we are going to start to hear more. You gave the example of a school. So, for example, if they were a member of a university, which is, we do not know.
Speculation, not even speculation, it's just an example.
Just an example. If they were, then that might be a situation where where they would need to alert some students, and then that would certainly get out to the public and
exactly.
and be more information that we could use to gauge how widespread, the exposures might be.
And that's part of the import to the governor having activated the Emergency Operations Center previous to this, and the import to her now calling it a state of emergency, because it gives the state certain opportunities to investigate things more aggressively, to potentially close areas off that need to be closed off, and it gives the task forces more resources to investigate these cases and, again, do what's necessary, ultimately, frankly, to protect residents within the state of Michigan.
So what we need to be doing right now is what we have been saying all along,
yes.
washing our hands more, right. Being careful about large crowds, and if you are in the higher risk groups, and that is 60 and up, and in particular 80 and up, or if you have any serious medical
right.
conditions, that's when you need to be extra careful about these things. So not going places unnecessarily, making sure you have supplies at home. So if we do reach a situation of quarantine, you don't need to be rushing to the store.
Now, and to that point, I don't want anybody to say, this is now different, we need to rush to the store. Don't rush Kroger and Costco and whatnot tomorrow. That's really not the point. This is something that, frankly, you should have already been doing for quite some time. You really need to think, though, about the potential that things will escalate within the state, and so consider, buying an extra can or two of food next time you're at Costco, and the next time, next time you're at Kroger, buy a couple extra cans of things, keep them in stock. But the main thing really with this is community mitigation. That is, we want to limit the spread now that we know, again, that it's verified here. And that, the governor basically spelled out the simplest things, when she was giving her press conference. Wash your hands. Don't touch your face. Cover your coughs and sneezes. Make sure that you're, cleaning commonly touched or high-touch areas. And make sure that you're staying home if you're sick. If you have any suspicion that you may be sick with coronavirus, you should contact the health department, and I believe they will give you some guidance as far as where you might be tested if it's necessary. But these are all things moving forward that are going to accelerate very rapidly, and we've seen accelerations in other states. I mean, if you look at what's happened in the state of Washington, in the state of New York, they actually quarantined an entire community already. So these are things that we expect will happen based on the case counts and based on future developments. Right now, 2 cases is not enough to do anything like that, but it's definitely enough that it lights a fire and it says, hey, we need to investigate more aggressively and we need to do a lot more community tracing. And that's what they're going to be doing. They're going to be doing a lot of contact investigation. And I'm sure that there will be more details coming out in the next few days about these 2 patients, what their health status was. The details that we have is one's a male, one is a female. They're both middle-aged, apparently, and they are both hospitalized. And that's kind of important because some of the criteria for testing really included the necessity that they be hospitalized in order to qualify for testing, if you will. That may end up being relaxed in the future because by requiring hospitalization as a criteria for testing, we would be missing cases in the community. So I imagine, if you get a call from a health official saying, hey, do you know this person? Did they come in contact with you? You might be asked to come in for testing. Don't be surprised. Those are the kinds of things that we at the media would actually like to hear, because that would help us get an idea of the scope of the investigation as well. Because the state, it's not that they're hiding anything, but they're limiting the amount of information based on, in a way, need to know. And they will share things as we need to know, but sometimes it's actually nice for us to hear it as well ahead of time. So if anybody in the community hears, verified information, that would be really, useful for us to have some handle on it, because we're tracing this just as actively as the state. And hopefully, we can partner with everybody that is at the state level to try to get the most useful information out there.
Good to go over the symptoms again, just in case you haven't heard them. Fever, cough, shortness of breath, in the more severe cases, pneumonia. Obviously, it is cold and flu season, so there's a lot of people out there with a fever, a lot of people with a cough. But as we learn more about, where these people were, that might be something important for people to pay attention to. Right. If you are concerned, you can call your doctor and talk to your doctor about it. Say, I have concerns. They can help you tease out a little bit better. If you might be someone that needs to be tested, we did learn today that the private labs are going to have a lot more capacity for testing, which should open up testing for a lot more doctors who want to have patients tested and not just be limited to the few tests that the state's been able to run so far.
And that's what we really hope will happen, because that's, I think at the heart of all of this, in order for us to have a handle of how far this infection has reached our community, we need to test more people. That's quite frankly the bottom line. Again, 63 tests is just not adequate to get a good handle on, and this is not a criticism, it's just only 63 samples have been submitted to the state, to be fair. So, but 63 samples is not enough to get a good handle on community spread. So we need, patients and physicians to step up and submit samples if they have a significant concern. Now, admittedly, right now, in order to be considered a patient under investigation, there are certain criteria that need to be fulfilled, but they are gradually going to be relaxed. Some of them are basically direct exposure to an individual that may be infected or may have been infected. So if for example, you were exposed to one of these two people, that is criteria basically to be tested if you have any symptoms especially. If you do not have any symptoms, that's a little bit of a softer call, because before you're symptomatic, technically you can actually spread the virus, but the question of whether your test will be positive is unclear, because you have to shed a certain amount of virus for the test to be positive. So when we do a test, when we swab your nose and we swab your throat, we're looking for viral particles, or a viral RNA, actually, pieces of the virus. If you aren't shedding enough virus, those tests won't be positive. So I think that's a relevant thing.
All right, so we have some new information. So far the test has 57 negative tests. There are now 18 new tests that are pending. So those will presumably be run tomorrow. And we have 87 patients that we're actively monitoring.
Right.
So that means people that, have been exposed to people that they're asking to check their temperature, check in with health departments, stay home.
Right, so they cleared the 24 that were pending today, and so now there's 18
22 of those came back negative, the 2 positive that we know about, and now 18 potential.
Yeah.
And we do expect these numbers to go up. As we test more, we will find more. I mean, we saw in South Korea and Italy, when they started widespread testing, the numbers skyrocketed.
Exactly.
And it wasn't that they suddenly had that many more tests, it was that they suddenly had those test results.
Right, in a way, these are canaries in the coal mine, in the sense that, these are early signs that it is here. But in point of fact, for every case that we identify, there are many, many other cases that probably have not been identified, either because they were minimally or just not symptomatic at all. Unfortunately, right now, the test that we have tests for viral particles, so that is pieces of, again, the RNA that is in the virus, and they don't test for whether you have been exposed and recovered, actually. So that's a different kind of, that would be a blood test, that would be an antibody test. We don't have an active antibody test. That's still actually under development right now. But the test that we are doing right now, looking for active infection, that's good if you are shedding virus. But once you have had the illness, even if you were mildly or even asymptomatic and recovered completely, you will no longer shed virus after a period of time, and your test would essentially be negative at that point. So we would miss that window of investigation in your particular situation. But that's okay, because you recovered. The issue is, in that period of time, it's good for us to know about it, because it means that we have, if you didn't know about it and you were out in the community, we missed an opportunity to limit your exposure to other people and the spread. And that's really, I think, again, the big issue here is that the way that we can attack this COVID-19 situation is by limiting community spread. And that means limiting community spread to healthy people, but most importantly to people that are high risk of developing severe disease, ending up hospitalized, ending up in serious condition, or ultimately critical condition. We know if you end up in critical condition on a ventilator, for example, there is a 50% chance that you will die. So only 5%, a small number, will end up in that critical state. But 50% of people in that critical state will actually die. So that's why we want to try to limit the number of people who are at high risk of ending up in that position by limiting the spread. That's where all of this public health measure comes from, because frankly, there's nothing we can do to treat you directly. There is no vaccine, there's no antiviral medication, there's nothing we can do that will stop or slow this down once it's in your body other than your own immune system and time.
Well, and we've seen out in Washington State what happened when it got into a nursing home, which is just full of people who are in that high-risk group, who are older, who do have other health conditions. We do want to talk about, though, the recovery, because this is not Ebola. I mean, people can recover from this. 80% of the cases are mild. So talk a little bit about the recovery.
Well, so, in fact, the latest numbers globally, so 119,179 people globally have been diagnosed with COVID-19 at some point. But 66,000 have recovered. So 119,000 diagnosed, 66,000 recovered. That's like half of the people have recovered, not deceased, recovered. So that's an important point. The vast majority of people that are being identified, well, I shouldn't say vast majority, the majority of people that are being identified are recovering, and recovering, as far as we can tell, uneventfully, although clearly there will be longer term studies that might suggest that there would be some sequela after this kind of an illness. But we don't really know that yet for sure.
And not in that number is all the people who had illness that was too mild to even be counted. So there's other people who aren't even counted as recovered who had mild illness. But the concern really is that 20% that get the severe illness, and that's who we're trying to protect with these public health measures of limiting the spread.
Exactly, and it's really all we can do. So again, that's why it's so important to do what you can, that is washing your hands, not touching your face, covering your coughs and colds, not sneezing at surfaces. Frankly, be courteous. If you sneeze in an area and you know that clean up after yourself a little bit. I mean, these are simple things that we can do to help protect each other. And the Detroit metro area is a little bit different than other larger, more compact metro areas where there's, for example, a lot of public transit. We don't have a subway. We tend to travel in our cars, quite frankly. So, there are different opportunities to limit the spread here just by providing simple hygiene, because we are not quite in as tight a proximity as they would be, patients would be, for example, in New York City. So, there are some useful opportunities. Now, ultimately, I'm sure it'll be released where domestically the individual traveled and where internationally the other individual traveled. But either way, I think what it highlights is that providing simple hygiene, because we are not quite in as tight a proximity as they would be, for example, people that travel can acquire the disease and bring it home. And that's something that is an important consideration if you are considering travel, because clearly these two individuals traveled and ended up with COVID-19 and bringing it home and ended up in the hospital. Hopefully their condition is, moderate to serious, otherwise they wouldn't be in the hospital, but certainly, things change, and I think that's an important element, is that, travel is something that was a risk in both of these individuals.
I just wanted to ask, so we're getting a lot of comments on
this is Ken Haddad, our web producer.
On where it is. I just wanted to offer some context. Is it unusual for the Michigan Health Department, or in any situation like this, to not disclose where the city, the exact city? Do they normally just offer a county? How does that usually work? Is this any different than previous?
Well, so for patient privacy, patient, it's all about patient privacy. Yes, and that's a really important thing. I mean, they're not trying to hide anything or anything like that. It's patient privacy. They basically can't disclose a lot of information without the patient's permission. And at this point, it's likely that the patient, frankly, they just found out that the patient was positive tonight, a couple of hours ago. So this is very much breaking news at this point. At some point, they will probably have a discussion with the patient. They will have to identify, it's a matter of public health, they will have to identify all of the patient's contacts, their close associations, where they live. The state is going to know that.
I think we can look to the man from Westchester, New York, as an example where they closed the schools that his kids went to. They looked at the houses of worship where certain people had visited. So it is something that will come out as the investigation goes forward, as they talk to people.
Exactly.
But that's not something that we expected them to release, and they did not tonight.
And that would be standard. I mean, at this point, you can't disclose patient information without their permission. Although the state, from a public health standpoint, does have a responsibility to identify all of their close contacts, notify them, and do contact tracing to try to limit their exposure and identify who they may have secondarily been exposed to. And now the web spreads. So this person 1 and person 2 contacted however many people, and those people are going to be monitored, and whoever they contacted are going to be monitored, and so on and so on. And that web is going to need to be studied over a period of time.
And to be fair, I mean, the state is going to be, they're going to be doing these interviews. I mean, they just got this positive back.
Right.
So they have a lot of interviews to do.
Oh, yeah.
I mean, we saw with CPAC, they are still going back through the photographs from CPAC and finding out who the individual from CPAC had interactions with. And that was an event that was widely photographed.
Right.
So that's not going to be the case for an individual going through their normal life. And depending how sick they are, they may or may not be able to, offer as much help or more or less help about who they had contact with. And think about how many people you have contact with in a week or 2 weeks.
Right.
And
that's absolutely
piecing all of that back together.
Right. If someone came to you and said, where were you on this day, this day, and this day, and when did you become sick? So now, the process would be, well, when did you first become symptomatic, and when was your travel? And in that interval, the incubation period, who could you have come in contact with?
Right.
And that's really, the thing that they're going to be focusing on. Hopefully, I will add, hopefully, whatever hospitals these two individuals are at, have taken appropriate precautions to protect the healthcare workers, because that's an interesting element to this whole thing. If somebody comes into the hospital and we don't know that you are a high-risk COVID-19 patient, we may not take the same level of precautions. It sounds as though, given the international travel in one case, there's a high probability that they had a suspicion and they would have taken high precautions. The domestic travel situation, they may not have taken that same level of precaution. Let's just say, and again, this is just an example, let's just say that they said, well, I just came back from New York. And New York, at the time when they came back, let's say a couple days ago when they were just feeling a little under the weather, just was not that high on the radar at that point in time. The healthcare workers may not have taken that level of precaution. These are, again, this is just an example, but that's why we on the front line as healthcare workers really need to pay attention to the travel history in particular at this point, and or any contacts. If someone says they have a known contact of a suspected case, you need to take that very seriously as healthcare workers out there.
Now, we were looking at the map earlier, and we're down to, I think, only 12 states that don't have a confirmed case, although presumably it's probably in those states now, and they just haven't gotten a positive test back yet.
Some of the smaller states, are probably, let's just say, Montana, there may not be a case for quite some time, but many of the states that are basically nestled amongst other states that are positive, there's a high probability, just because of travel across borders, there's a high probability that it's just going to make its way into the state naturally. These states and the entire map of the United States will eventually shade. Quite frankly, I think in many ways, to me at least, given how the map has become shaded across the country with cases, Michigan in a way kind of stood out as an unshaded state because we did not have a case until now, or 2 cases. That, in a way, sort of surprised me that it's taken this long for us to identify that. But again, the state can only run samples that they were given. Yeah. So, it's up to physicians and it's up to patients to have some ability to go to their physician and say, I need to be tested, or physicians to say, you need to be tested, and submit the samples to the state so we can get a better handle on the magnitude of the cases within the state of Michigan in particular.
Well, and to be fair to physicians, they couldn't submit those samples from patients who weren't hospitalized and met this very narrow criteria.
Right.
Hopefully we see some of that change as this situation evolves.
Right. So the criteria that, so we've been, as a physician at a local hospital, I was given some guidance as to who should be tested, and some of that guidance included people who were older or who had comorbidities, who were admitted with severe disease, admitted to the hospital with severe disease, or people who had traveled and were admitted to the hospital with severe disease. The only time that you could get tested without having been admitted to the hospital was if you had been in contact with a known COVID-19 patient. Now that was, again, the guidance that I was given at my hospital. Other hospitals and other areas in the state may have had different guidance. That's not completely clear to me. Right now, if you look at the CDC, actually, the guidance document is purposely very broad or vague, depending on how you want to look at it, but they're giving physicians, healthcare institutions, and individual states a great deal of latitude to decide who needs to be tested and how they should be tested. So I think hopefully the state of Michigan will broaden their criteria a little bit and start to look at these cases more aggressively, because ultimately we need to figure out what the N is, that is what the bottom line is, number of cases in the state.
All right, so I'm going to ask you the $1 million question. When does this start to change things locally? I mean, when do we start seeing big gatherings being canceled? When do we start seeing schools closed? Right. I mean, we saw this happen in New Rochelle. That was 108 cases.
Right.
We're at 2. How do you see this playing out? And well, it's the $1 million question for a reason.
In a way, I had talked about this before. When we had the first U.S. case and it was travel related, I said, what's going to change everything is when we find the first non-travel related case. That is the first case that says community spread. Well, it's really kind of going to be the same thing in the state of Michigan. The fact that both of these cases essentially have a traceable link, so presumably the domestic spread was to an area or to a direct contact with someone with known COVID-19. That's what I would infer from them saying that it was domestic travel. But that's a fairly big inference. But the point is, once we have documented community spread, that is, once a positive comes up and the question is asked, did you travel anywhere? Did you come in contact with anyone with known COVID-19? And the answer to both of those is no. That's when we know that it is present in our community and essentially now somewhat endemic. That is, it's reached a level where there is community spread. Endemic is maybe an overstated word. That's not the proper word. But it definitely means that it would be in our community and that we need to be aware of it if there is community transmission without any significant risk of either having traveled or having been exposed to a known COVID-19 patient.
I think it's going to matter, too, what they find in the close contacts of these two people. So just in case you've joined this late, we've had 2 confirmed cases, one in Oakland County, one in Wayne County, both middle-aged, both hospitalized, a man and a woman. But if we start looking at their family members, at their coworkers, and we find more positives, then that's going to be a game changer.
Yeah. I mean, absolutely. If either of these individuals had contacted, let's say 5 people, and those 5 people have, a low-grade fever and a little bit of even a sore throat, some minor illness, they're going to be tested. And if they're tested and they test positive, at that point, they have probably been in the community and they may have already spread it. So the contact trace would begin with them again, and everybody that they contacted could be at risk. So yes, I mean, absolutely. It's that web of spread. And that's when we'll know that there will be essentially sustained community transmission, when we start to see that leap where there again isn't any direct link. Now, we expect, or frankly, I expect, I should say, based on the way it has already spread within the United States, there is probably community spread within Michigan. We just haven't really identified it yet. That is my bet. And I say that because we have people in Michigan that have traveled not just internationally, but around the country. They've been back for, various periods of time. The first U.S. case was 49 days ago. In that period of time, in 49 days, the U.S. case count has gone up to 978 as of today. So that's 978 documented cases in the United States. There are far more cases, I guarantee.
And that's with a very, very low level of testing. I mean, we've just, for various reasons, we've tested very few people in this country.
So there would be no reason to think that within the United States, people from other areas may have traveled to Michigan and spread it, or people in Michigan may have traveled to other places, acquired it, and returned home. That would just come as absolutely no surprise and should come as no surprise. That's just the natural course of a respiratory spread virus. And so, this is something that we knew was coming and that we expected. And it really doesn't change anything from the standpoint of those expectations. Again, what it really changes is that we now have confirmation. And in a way, you should have had your game upped already. You should have been washing your hands and all of those things. But now you have a real, if anybody questioned it and thought, well, no, it's not really here, now you have a real reason to say, nope, I really need to do this now. It's no longer something that you can wishfully think away. It is definitely something that, that we need to take very seriously within the state of Michigan, as evidenced again by the governor declaring a state of emergency.
Okay, so let's say someone watching this, they are in that age group. They are over 60.
Sure.
They have serious medical problems. What do they need to change in what they're doing if they haven't changed anything already?
Yeah, so, I'm not sure that there's anything you need to change other than, as much as you can, avoiding large public gatherings, avoiding close contact in areas. I might take extra precautions, for example, if you're going to the grocery store. It's even something simple like that. Have a wipe and wipe down the little bar on your cart. Things like that. Avoid shaking hands. It's that personal hygiene, especially if you're in a high-risk group. But the issue is that everybody's going to have to, I think, look at their own individual risk factors. And we know, for example, and I talked about this earlier today in the news, the risk factors that are associated with more severe disease in terms of diseases are cardiovascular disease, lung disease, high blood pressure, diabetes, kidney disease. Those are all immunocompromised, cancer. I can kind of go on. In a way, basically, it's all things that make you sick, put you at higher risk, things that essentially weaken your defenses, that lower your immune system, decrease your ability to fight off viruses. If any of those are present, and especially on top of it, you are of older age, and everybody defines it a little bit differently. The studies have defined it over 70. The CDC has used over 60. In either case, the point is, I think a 60-year-old with absolutely nothing wrong with them, that is healthy as a horse, so to speak, is a different animal than a 60-year-old who has high blood pressure, diabetes, and heart disease. Yeah. So, you need to just sort of factor that in your equation.
I want to bring up asthma because we've had a ton of questions about asthma. You said on the news today the research is mixed, but what is your feeling about whether someone whether their other serious health problem is asthma? Do you think they are at a higher risk?
Yeah, so the research is mixed, but my personal feeling is, because this is a respiratory disease and asthma is a respiratory problem where your ability to clear your secretions, that is cough up mucus and breathe easily, is limited by your own asthma. So in a way, it would be very counterintuitive and very surprising to me if a study came out later showing that asthma was not an important risk factor for developing severe disease. That said, there actually has been a study that looked at about 140 patients in China, and the issue there is they basically concluded that asthma and COPD were not risk factors for acquiring the disease. However, they didn't have any patients that had asthma or COPD in their cohort, in their group that they studied. So I don't think they can draw that conclusion to a meaningful level. So I think there's definitely more study and research that needs to be done. And I would personally consider asthma a significant risk factor at this point, and be especially cautious if you have especially serious asthma, where you're taking either a control medication on a regular basis, a steroid, for example, or if you're using your inhaler consistently. Yeah. The other.
I was looking at some of the comments before we came on, and there was some saying, the media is hyping this up. It's being overhyped. I want you to take off your reporter hat for a minute and put on your doctor hat. Do you think we're making too big a deal out of this? Do you think we're scaring people too much? Do you think it's a lot of hype?
So this is kind of an interesting thing, and I've thought about this a lot because I talk to a lot of people in the community. I talk to patients in the emergency department that I see. I talk to my colleagues in the emergency department, nurses, techs, other physicians. And I've noticed people come in two groups. They come in the group of the sky is falling, I need to go buy a gallon of hand sanitizer and, stock my pantry. And they come in the group of, oh, it's not a big deal, the media is hyping this, and this is all just overblown. The reality is, it's really somewhere in between, and everybody needs to think about their own risk factors. The simple reality is, the facts, 80% of people who get this, basically SARS-CoV-2, so the novel coronavirus.
That's the actual name of the virus.
Name.
Yeah, he likes to use the real name.
The fancy name. But 80% of people who get COVID-19 are going to recover uneventfully with mild disease. That's a fact. So if you look at that and you say, well, gosh, I'm going to recover uneventfully, I'm going to be in that 80%. What am I worried about? That is missing the fact that 20% of people develop severe disease, end up in the hospital, and of those 5% more, that is, or of that 20%, 15% get severe disease, 5% end up with serious severe disease on a ventilator, for example, and of those, half will die. So to say, oh, it's overblown, well, you've just overlooked 20% of the population that is going to get this illness.
Well, and the problem with that is,
disease.
So I'm in the 80%, I'm young and healthy, but my mother is, in her 70s.
Exactly.
I don't want to give it to her. I don't want my kids to give it to her. I don't want my in-laws to get it.
Right.
I mean, most of us have people in our lives who fall into that 20%.
That's absolutely true. And I think that's really, again, where the public health effort comes down to preventing the disease to protect the most vulnerable in our community. But I really have to add also, the aggregate statistic is 80% of people will recover uneventfully. Mm-hmm. Most of those 80% of people are, in fact, young without comorbidities, that is, other medical problems. However, there are people in that 80% that are young, healthy, and I shouldn't say within that 80%, there are people that are young and healthy that ended up in that 20% that developed severe disease. Now, we don't know what the problem that caused them to have more serious disease was. That still has to be teased out. But the point is, just because you're young and healthy does not mean you are not at risk for developing serious disease. So you would be in some way, I guess, selling yourself short. The odds are in your favor, I'll give you that. But basically, you can't say it with enough certainty to basically, what I would say is risk your life on it. That's the long answer to no, I don't think we're hyping this up at all. I mean, I think we're trying to communicate the facts to you so that you have some proper understanding and you can calibrate your response to it. And if anything, part of it is just being a good citizen. I mean, this is not about you. This is about protecting our community and about allowing the community and the state and the country to function normally. I mean, I want you to think about something for a second. Every time one of these patients comes into the hospital and is not identified at triage for whatever reason, because they didn't have a known travel history, they didn't have a known contact history, and they come in and they incidentally cough and sneeze on a healthcare worker that didn't know to protect themselves from them, that healthcare worker is now at risk. And everybody that they've contacted is now at risk. And we have to take ourselves out of circulation. So now I have to quarantine myself. Right. Well, imagine now the ramifications if all of the healthcare workers, and this is actually part of what's happening in other areas, many healthcare workers are having to go in quarantine because of these unexpected exposures. Well, that's a big deal. And that's part of why being a good citizen and limiting the spread of this disease is really important, because it has a ripple effect, because each one of these healthcare workers has a family and they may have a spouse that works, and that spouse may not be able to go to work now because they're also under quarantine. And that's the ripple effect that it has within the community.
And there is a lot of value in buying time with something like this.
Oh, no doubt.
There are several medications that they are now testing, that medications that already exist, that they're testing to see if they will be beneficial about this. If there is something that we can give people that helps them recover faster. Yes. They are on record pace to try to develop a vaccine. It's going to take 12 to 18 months, but there is every reason to believe that this will keep going and come back around, and it could even be a seasonal thing that turns into something that just becomes part of the viruses that spread.
And the other thing I would add is, every day that goes by, we learn more about this virus through studies and through experiences in other parts of the world, and that information adds to our ability to fight the virus, to identify the highest risk of transmission, identify groups that we need to focus on more, not just for developing severe disease, but potentially acquiring the disease and spreading the disease. All of these pieces of information that we acquire over time, that we're buying ourselves by mitigating or limiting the spread, is really important. And that's again, this is a new virus that nobody's ever seen. It's a new virus that we can't predict. And that's what I don't want to say is scary about it. That's what we have to be aware of so that we can take proper precautions. It's not about panic, it's about preparing, it's about being thoughtful about our approach to everything.
And we have a lot of issues with the comparing of it to the flu, because the flu is something that there is a vaccine for, that some people have some level of immunity to if it's a strain that they have had before or seen before. And the flu is something that, the numbers of deaths that we see and numbers of illnesses that we see for flu is when millions of people are getting it. We haven't seen millions of people get this disease yet. And so the numbers would look different if we saw that.
And, and in point of fact, we've had, again, 978 cases in the United States as of today, with 30 deaths. Ultimately, when those numbers multiply, we will see a higher death rate. I mean, that's just what we expect. It's not, it's not to sound alarmist. It's just that's sort of the natural course of it. I mean, the situation that occurred in the long-term care facility in Washington State, that was a worst-case scenario. But there is absolutely no reason to think that worst-case scenario may not replicate itself in another part of the country, in the United States. Some of the data that we don't know in China, for example, is how many individuals might have been in long-term care facilities in China. We just don't know that information. So there's a lot of other factors, I think, to take into account that are essentially somewhat unknown at this point. And that's, again, why the time is really important. But just again, to recap, the two cases, one in Wayne, one in Oakland County, we have very limited information. Middle-aged individuals, both hospitalized, one male, one female, one associated, that is the Wayne County individual was associated with domestic travel, the Oakland County individual was associated with international travel. So that's important because that says they probably picked it up somewhere else. That's, I think, the implication from those statements from the Michigan Department of Health and Human Services, from Dr. Khaldun and from the governor. But ultimately, again, more will need to be teased out. That domestic travel, where was it? Maybe it was just to Ohio. I don't know what, when they say domestic travel.
I was going to ask you, there weren't any reporters at this press briefing, but if you had been there, what would have been your questions that you would have asked? What's top of the list that you would have asked the governor or Dr. Khaldun?
Yeah, it would have been really, if they could have disclosed this, I don't know if they would, but it would have been really useful to know when they say domestic travel. Where was the domestic travel? What was the time frame from the travel to the period when they actually presented to the hospital?
That would be
how long were they symptomatic in the community? I do believe they will probably release some of those details over time, but those are some details that would help me, give you some meaningful information about the potential for spread within the community. Even the international travel, I think it would be useful for me to know whether it was, they were on vacation in Italy, or did they come back from China and they were, perhaps somebody that was a local individual who, was coming back from maybe even another part of the world, Iran. I mean, we have a substantial Middle Eastern population within not only Wayne County, but Oakland County as well. So that's another conceivable thing. Again, this is all speculation. But I guess the point is it would be useful for me to have some idea of that, because it gives me some calibration about I think the degree of community spread in other parts of the world as well, and the potential for communicability. And those are all things that public health officials around the globe are really struggling with, is trying to figure out how communicable all of this is. But at best we can tell, so again, I go back to some sciencey stuff. The R naught, that is the number of people that we expect might be infected from one person, is about 2.8, and the doubling time is roughly 7 days. I did some math, and it was interesting. There were 49 days since the first U.S. case was described. So 49 days, that's about 7 doubling times. Now, if you look at 7 doubling, if that was only one case in 7 doubling times, you would expect about 256 cases, I think. And in fact, we have 978 cases. So that means
but they didn't all come from
cases,
that person.
Right,
that person
exactly.
was contained and
that's the point.
Was a success story.
Right, and that's the point. There were obviously other cases. So that doubling time is representative of the fact that there were other cases that were also in play. And again, the 978 that I keep quoting, that's what was the case count as of today. That does not mean those are all the cases in the United States. Those are the cases that have been tested positive in the United States.
Those are most certainly not all the cases in the United States.
Exactly.
All right, we're talking about travel, and I'm going to bring it up because the number one question that we are being asked in our personal and professional lives is, I have a trip scheduled, should I go?
Yeah, and and there's a lot of interesting guidance that goes with that. You have to consider a couple of things. You have to consider your own personal risk factors. So if you're an older person with a lot of comorbid diseases, you are at high risk for acquiring it. So if you're traveling to an area where there is either widespread illness or certainly community spread, I think it would be ill-advised to make that trip. I mean, it's really that simple. Air travel by itself does carry a certain amount of risk. I would not consider air travel within the United States to be a high risk at this point, but it does carry a certain amount of risk. There's no doubt about it. The cruise industry is sort of a whole nother beast by itself. I mean, you're on a ship, closed quarters, shared common areas that are small where there's a lot of people congregating. There's people brought in from around not only the United States but around the globe that might be carrying disease. So it's a very different mix. And so cruise ships, if you are somebody that is at high risk for acquiring disease, would really be an extraordinarily bad idea. And in fact, the cruise industry is well aware that that people have trepidation about it, and they've in fact changed a lot of their policies with regard to either canceling trips and offering a refund, or potentially just postponing the trip for a later sailing. But you need to look that up, and you need to contact the cruise line, because every cruise line has a very different policy at this point.
Well, and you run the risk too with a cruise. Even if you are healthy and you go and you don't get sick, you run the risk of being quarantined on a ship or needing to be quarantined when you get home.
Right, exactly. So, I mean, look what's happened with the cruise ships that have identified cases on board. All of a sudden, next thing you know, that ship is being diverted. They're disembarking the individuals right into a quarantine facility, and that's for the safety of everyone in the public, actually, because those people are at risk. I mean, look what happened. The Diamond Princess is a perfect case where hundreds and hundreds. I think it was 700 was the total count. Hundreds and hundreds of people ended up infected, and the likelihood is it was just probably 1 or 2 people that boarded the ship with coronavirus, and ultimately 700 and something people ended up infected.
We are going to wrap this up. You are going to be back on the morning show to talk more about this. Please, if you have questions, submit them to the website. You can find it on the main page or on the health page. You can also share them on Facebook. I'm sure they'll get them to us as well there. So thank you for joining us. What's the bottom line for people?
For staying up late. I think the bottom line here is the state of Michigan has announced the 2 cases. This really just confirms something that we already know. Hopefully you have already been preparing. If you have not, this is definitely the time. This is a wake-up call. This is the time to definitely step up and be aware. But ultimately, this is now in a more active phase. The state of Michigan has declared a state of emergency. There is going to be more aggressive contact tracing and testing, and everyone in the state just needs to be aware. It is here. Sit up, pay attention, do the right thing.
Thank you.